gentlemen, this is Frontline from Key Wealth, and today we're going to have a look at the new Smart Saver plans for 2026 brought to you by Discovery. Like they always do, there's a classic option available and an essential option available. Let's dive into what these plans offer for 2026. Okay, so our first stop on this walkthrough is that these options pay unlimited. You've got unlimited cover for hospital admissions. You've got access to your chronic medication. You have extensive cover for maternity benefits. You do have access to the personal health fund, which is very cool. Full cover for hospital-related events. Screening and prevention. You've got your overseas travel, and then you have some day-to-day benefits. Okay, so let's look at these options. Very similar to the Classic Smart and the Essential Smart. These options just come with an additional medical scheme savings account. So first up, you've got unlimited GP consultations on the Classic plan with a 75 Rand co-payment for each. It's similar on the Essential Smart with 130 Rand co-payment. Both of them provide you with an eye test and with a co-payment of 75 Rand and 130 Rand respectively. Both of them cover the dental checkup. Please note that this does not cover any of the work done. 130 Rand on the Classic plan and 195 Rand on the Essential plan. They both cover over-the-counter medicine, 905 Rand per family for the year. This is now Schedule 0, 1 and 2, and then 605 Rand on the Essential plan. Something that the Classic Smart Saver has that the Essential Smart Saver does not have is the benefit of acute medicine. You'll see here 1,970 Rand per member, 3,300 Rand per family. There is a formulary for this, and it is a network pharmacy, and it is only for Schedule 3 and above. Okay, on the Essential Smart Saver, your acute medicine is covered from your medical scheme savings account. Both of them provide benefits for contraceptives, 2,600 Rand on the Classic Smart and 2,200 Rand on the Essential Smart. Both of them have cover for sports-related injuries, which is very nice, and then both of them provide cover for an emergency room visit for kids 12 years and younger. Just note on the co-payment, 75 Rand on Classic and 130 on Essential Smart. You do have access to your personal health fund, so very cool. On the Classic Smart plan, 2,500 Rand per adult and 1,250 Rand per kid, so that's very, very cool. If you have access to that, then you boost your savings quite drastically. And up to 1,500 Rand per adult and 750 Rand per child, to a maximum of 6,000 per family. So that's very nice. And then you also qualify, if you do the challenges in your personal health pathway, another 10,000 Rand that's available and another 6,000 Rand respectively on the Essential Saver. So a big difference, like always, on the Classic Saver, Smart Saver, there's a 200% hospital benefit, and on the Essential Smart Saver, there's 100%. So very important to have a look at that. And then just to know that certain in-hospital procedures are not covered in this plan. We'll have a look at the exclusions a little bit later. Health pathways, it's Discovery's way of motivating people to live healthier lives. There's a lot of stuff that you can do here. So one of the new things that will be tracked is your sleep score. So if you get a sleep score of 75 and above, that's great for you, and you will be unlocking these challenges. And if you've got Vitality, you can even get some Vitality points on that. You can track this with your Aura Ring. If you're a Discovery, Vitality and Bank client, then you can get access to that. So that's also very, very cool. Do reach out to us if you've got any questions about that. So the Personal Health Fund, important to do is you must activate it, enable your physical activity and sleep tracking, and complete a once-off high-value action on your personal health pathway. So most of these things is very personalized, and once you've done that, Discovery will actually kickstart your year with 1,000 Rand that you can get. And then just note at the bottom here the limits that's applicable to the plan that you choose. So very cool. And this money, if you're a family of 4, it's up to 20,000 Rand on the Classic Smart Saver that you've got for additional day-to-day benefits, and that's quite a lot. So very, very impressive from Discovery's side. There's a lot of screening benefits on these plans. So they do baby growth and development assessments. You can do your blood pressure, blood sugar, BMI, cholesterol, and HIV testing. They also cover a mammogram every 2 years, a pap smear once every 3 years, and then prostate screening and bowel cancer screening tests for certain age groups. So very, very nice. There are some additional benefits. You can pause on this slide and have a read through that. Here's a nice slide of how Discovery sums this up. On the Saver series, you have your unlimited GP benefits, you've got your medicine, your contraceptives, your checkups, your injury benefits, you've got your personal health fund, and then your medical scheme savings fund that's available to you for day-to-day expenses as well. So very, very comprehensive plan at the price point that they're offering. Important now to get your advance. In 2025, you have to complete a health check, and then you have to activate your fitness tracking and your sleep tracking, and then you can get R1,000 per adult to start off your year. Then you can earn up to R2,500 per adult on Classic and R1,500 per child if you do the recommended actions, if you follow that. And then there are 2 challenges in a year, and if you complete that, you can double the benefits that you receive. Those who are planning a family, you've got some antenatal consultations, 8 of them on these plans, so that's very, very nice. You've got some ultrasound scans, very cool, flu vaccines during your pregnancy, some certain blood tests that they pay for. And then afterwards, there are 2 visits at a GP or pediatrician, so that's also very, very nice. And then you do have some pre- and postnatal benefits as well. These plans do provide chronic cover. You can pause the video here and you can have a look at these conditions. If there's something that you suffer from, you can reach out to us so that we can assist you with that. Please just take note that they do use network pharmacies and also formularies. So it might be that a condition is covered but your medicine is not, or it might be that you take certain medicines that are covered for different conditions but you're not taking it for one of the conditions approved here. So if you've got any questions regarding the chronic, please give us a shout. The oncology benefit is quite good on these plans. So they provide you with 250,000 Rand in cover in a 12-month cycle. And then after that, you've got 80% that will be covered and 20% that's a co-payment. So very important here to have a gap cover, because gap covers can pick up a large portion of that bill, or they can settle the co-payment. And then just know that there are certain medicines that will not be covered in full. So with certain medications, Discovery will only pay half and you will pay the other half. Very important on this slide is if you go to the wrong hospital, you need to go to a smart network hospital. If you go to the wrong hospital, there's a 12,650 Rand co-payment. You can claim that back from a gap cover, so just check out that you've got a good gap cover that you can settle that with. And it's important for not necessarily planned procedures, but when something happens when you're traveling or you're on vacation or you're not at home, or even if you need a procedure but the surgeon or the specialist that you require does not operate or treat patients in a smart network and you are forced to go to another hospital, it's a very good thing to have a good gap cover there. Like mentioned earlier, these plans differ with there's a 200 and 100% rate depending on whether you're on the Classic or the Essential. You do have cover for MRI and CT scans. Just make sure that the scan must relate to an approved hospital admission. If it is for conservative back and neck treatment, Discovery will pay the first 4,000 Rand from your available day-to-day benefits. You can just pause here on the co-payments. So there's a lot of co-payments on scopes. Very important here again is a gap cover, because you can claim most of them back. Not most of them, you can claim all of them back. You can pause the slide here, but just so that you know, some benefits do have yearly limits. Again, a very good thing to have a gap cover, because you can claim an additional amount on internal prosthesis like bone-anchored hearing aids, cochlear implants, things like that from your gap cover if there's a shortfall. So these limits are quite high, but if you need something like a better joint or something that falls out of the treatment plan that Discovery would like to provide you, a doctor recommends something else, then you do have access to that. Discovery does pay for in-hospital dental treatment. There are, however, some rules regarding that, and if you are over 13 years old and you need to go in-hospital dentistry, there's a 9,000 Rand co-payment. It's slightly reduced if you use a day clinic, and then again, if you're under 13, there's a 3,470 Rand co-payment and only 1,550 for a day clinic. So here are the contributions. You can get this plan for an adult, the main member, 3,350 Rand for 2026. I don't think for the benefits that you get with your personal health fund, the booster, the savings, the unlimited GPs, that this option is priced badly. So that's very, very nice. And then also 2,750 Rand for the Essential Smart Saver. You can see your savings for the year. So it's not a big savings account, but remember, this is for everything that's not covered under your unlimited GP benefit or things like that. Or if you go to a dentist, you pay the consultation fee, the work will come from here. So on the Classic Smart Plan, 2,820 Rand for the main member, 2,300 Rand for the child and an adult, and 1,176 for a child. Okay, I'm going to pause. Please pause on this slide and just make sure that you're familiar with this. This is some general exclusions for Discovery. So all of these are general exclusions to both plans, and then these are additional exclusions on the Essential Plan. So just take note here, it's nail disorders, skin disorders, investigative procedures, functional nasal surgery, back and neck treatment or surgery, that's if it's not immediate treatment that you require, knee and shoulder surgery, joint replacements, cochlear implants, and those are to name but a few. So make sure that you do not need one of these procedures if you go onto the Essential Smart Saver Plan. These are not applicable on the Classic Smart Saver Plan. And that's it from my side. If you guys have any questions, please send us an email or reach out to us via phone, and we'll gladly give you any advice that you require on which option is best for you for 2026.